welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Can climate change increase risk of prolonged pregnancy? New Curtin University research has found exposure to outdoor air pollution and extreme temperatures during pregnancy may increase the risk of prolonged pregnancy, offering new insights into the impact of climate change on maternal health. Findings are published in Urban Climate. The study analyzed data from nearly 4 lakh births in Western Australia and found that higher exposure to fine particulate air pollution (PM 2.5) and biothermal stress was associated with pregnancies lasting beyond 41 weeks. New research highlights effective stem cell treatment for inflammatory eye diseases. In a new study, researchers have proposed a novel therapy for ocular graft versus host disease involving mesenchymal stromal cells (MSCs). The team explored the potential of regenerative mesenchymal stem cells in reducing ocular inflammation in graft versus host disease infected mice. The study published in the Ocular Surface explores the potential of adipose-derived MSC, ADMSCs, to reduce inflammation and promote tissue repair. Graft versus host disease is a common and severe complication that occurs after stem cell transplantation, where the donor's immune cells attack the recipient's tissue. Ocular manifestation of graft versus host disease is among the most challenging to treat, often leading to chronic inflammation and corneal tissue damage, which can result in loss of vision. Using mice that had been induced with chronic graft versus host disease, researchers administered adipose-derived MSCs into the eyes via single injection. Over 3 weeks, the researchers found that the adipose-derived MSCs treatment increased regulatory T cells while reducing inflammation in the mice. Further, adipose-derived MSCs conditioned media-enhanced cell migration and proliferation in laboratory scratch tests, showcasing the regenerative capacity of the cells. Importantly, the injected cells disappeared within a week, minimizing the risk of long-term complications such as tumor formation. Biomarker test may detect Alzheimer's pathology earlier, study finds. Years before tau tangles show up in brain scans of patients with Alzheimer's disease, a biomarker test developed at the University of Pittsburgh School of Medicine can detect small amounts of the clumping-prone tau protein and its misfolded pathological forms that litter the brain, cerebrospinal fluid, and potentially blood. New research published in Nature Medicine suggests. The cerebrospinal fluid biomarker test correlates with the severity of cognitive decline, independent of other factors including brain amyloid deposition, thereby opening doors for early-stage disease diagnosis and intervention. T, faster, simpler therapy for common cause of high blood pressure. Doctors at Queen Mary University of London, Barts Health NHS Trust and University College London have led the development of a simple, minimally invasive targeted thermal therapy, T, that has the potential to transform medical management of a common but commonly overlooked cause of high blood pressure. Findings are published in The Lancet. High blood pressure affects 1 in 3 adults, of whom a hormonal condition called primary aldosteronism accounts for 1 in 20 cases. However, fewer than 1% of those affected are ever diagnosed. T offers a faster, safer alternative to surgery by selectively destroying the small adrenal nodule without removing the gland. The new treatment harnesses the energy of waves, adapting 2 well-established medical techniques. Radiofrequency or microwaves generate heat in a small needle placed into the malfunctioning tissue, causing a controlled burn. Ultrasound uses reflected sound waves to create a real-time video of the procedure. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.